So on treatment of Lassa fever, WHO, this WHO fact sheet was written 5th December 2024. So we're in 2026. So this is the latest, that I found from WHO. Treatment, early intensive supportive care should be commenced. Early intensive supportive care, including fluid management and treatment of specific symptoms, can improve survival chance. You treat symptoms the person presents with, and fluid management, because they lose a lot of fluid from vomiting, from diarrhea, and all that. So fluid management is very important. And if these things are started early, it can improve survival chance. Now, WHO says there is currently no antiviral drug approved for Lassa fever. The antiviral drug ribavirin has been given as treatment for Lassa fever. Mhm. However, there is currently considerable uncertainties about its efficacy on the outcome of patients with Lassa fever, as well as its optimal dosing regimen. Whenever possible, patients should be enrolled into a randomized clinical trial with ribavirin or other investigational therapeutics to assess clinical outcomes and safety. Other candidate treatment options are at various stages of development and evaluation. Now, what is this place saying? Ribavirin is not is not officially approved for Lassa fever. For a drug to be approved for a disease, there must be strong evidence that the drug works for that disease. And there are trials that are done, randomized control trials, to show its efficacy, that it will work. Now, ribavirin is not officially approved for Lassa fever, but it's given off-label. And off-label something is that a drug is not approved for a condition, but some evidence, even though weak, has shown that the drug can work in that condition. So we now have off-label prescription. You prescribe a drug off-label, meaning that it's not officially approved for it, but it's been shown that it helps some of the patients, and so it's given. So ribavirin is given off-label treatment for Lassa fever. Now, it should be noted, they said there is considerable uncertainties. It's not certain that the drug is efficacious, and it's not certain about outcome for patient with Lassa fever. And the dosing too is not certain what the dosing should be. When we get to the dosing, we mention McCormick regimen, IRWA regimen, and all that. So the dosing is not certain, and there's no certainty about its efficacy. There are trials that are going on. There are randomized control trials that are going on with ribavirin and with other treatment options. In the Nigerian guidelines, ribavirin is used for the treatment of Lassa fever. Ribavirin is used, but it should be noted there is uncertainty about how efficacious, how effective is the drug. That should be borne in mind, and that's re-emphasize that, it shows the importance of prevention, since there's uncertainty about the effectiveness of the drug. So we should note that too, you know. But it is given for treatment of patients with Lassa fever. And it's given for people with close contact, people who are exposed, you know. It's given as prophylaxis, as a way of preventing the person from, coming down with the illness or with severe disease. For vaccines, there's currently no licensed vaccine for Lassa fever. The several potential candidate vaccines are in development. So usually we know that for viruses, Viruses are usually difficult to treat. Historically, viruses are usually difficult to treat. But what has helped is vaccine. Vaccine has been effective in dealing with viruses, and we have examples of that to show that vaccines are effective in dealing with viruses. But unfortunately for Lassa fever, there is no approved vaccine for it now. A lot of vaccines are in development, like on 4th of December 2025, you know, Oxford Vaccine Group, they announced that the first volunteer has received a dose in the first in human trial of Oxford Lassa vaccine, marking a major milestone in the fight against the deadly virus. The trial, conducted by the Oxford Vaccine Group and funded by the Coalition for Epidemic Preparedness Innovations (CEPI), will assess the safety and immune response of the CHAdOx1 um, Lassa Lassine vaccine. Well, this is the Oxford Group. Okay, it goes on to say that 31 people aged 18 to 55 will participate in the trial in total. It was developed by researchers at the Pandemic Sciences Institute, University of Oxford. The vaccine is made using the same viral vector platform as the Oxford AstraZeneca COVID-19 vaccine. So the kind of technology that was used in developing COVID vaccine for COVID-19, the technology is also being used to develop a vaccine for Lassa fever. So testing have been done in animals, and it is being safe enough to now test it in humans. The testing of vaccines take different stages. This first stage is you test it in healthy individuals, those who are not sick. You test it in healthy individuals to see. Now you have 18 to 31 people. um Test it in healthy individuals to now see the safety of the vaccine and the immune response of the vaccine. It's after doing that, and if it's safe and there's effective immune response, you now move to another stage where you now test it in those who are healthy and those who have contact, or those who are sick with who have contact with the disease. you know so US CDC January 31st 2025 says that ribavirin, an antiviral drug, has been used successfully to treat patients with Lassa fever. It is most effective when given soon after a patient becomes sick. The ribavirin. Patients should also receive supportive care, including rest, hydration, and treatment of symptoms. African CDC says ribavirin, an antiviral drug, has been used with success in Lassa fever patients. So ribavirin is still being used. It should be noted that there's uncertainty about how effective it is. The November 2018, the NCDC, Nigeria Center for Disease Control, released national guidelines for Lassa fever, you know, case management. So this is the one I got. I couldn't get a more recent guideline. And it says drug treatment of Lassa fever. The drug of choice for treatment of Lassa fever is intravenous ribavirin given through the vein. Intravenous ribavirin is administered over a period of 10 days. The outcome is more favorable if treatment is commenced within 6 days of onset of symptoms. So if you develop symptoms, starting it within 6 days. If you start developing symptoms, you start ribavirin within 6 days of developing symptoms. That's when you have a more favorable outcome with the treatment. So there is the McCormick regimen, there's the IRWA regimen. We have also the modified McCormick regimen for pregnant women and the McCormick regimen for children. So we have different regimen. There are centers for treatment of there are centers where the it's treatment of Lassa fever can be given. There are more centers now. The thing is for there to be high index of suspicion so that samples can be collected, diagnosis confirmed, and those who are confirmed positive are isolated or taken to isolation units or isolation centers from where they can be treated, and then contact tracing will be done, to contact those who were in contact with the patient who is confirmed to have Lassa fever, and then you know other things can be taken, can be done from there. So prevention and control, you've mentioned these things when I was talking about transmission.